Hello everyone, this is Instructor Howard, and we are breaking down coding cases for BC3020 Week 5. Today we will be covering coding for a coronary artery bypass grafting. It seems very detailed, but the way that this particular presentation is going to be delivered is that it's going to make everything easy and understandable. You need to have a copy of the test with you, something to take notes with, as well as some diagrams of the coronary artery system or the heart. I do have a few diagrams that I have shared in this presentation, and what you would like to do is download a copy of the PowerPoint of this presentation as I'm going through so that you can see the different arteries and vessels that I will be discussing to make everything more easier for you to understand. Okay, let's get started. And what I have here are details to a coronary artery bypass. This is just showing us how a vein graft looks as it's been anastomosed onto a blocked vessel. This yellow liquidy looking stuff that we see here is considered blockage. And I do have a list of terms that we will discuss today. But for the sake of terminology and knowing what these words mean, this particular diagnosis or condition is considered atherosclerosis, which means it is a hardening or plaque inside of the arteries. The physicians will usually document this as an occluded vessel or occlusion. We also see what an artery graft or an arterial graft looks like. And as you can see, the artery displays in red because it's full of blood supply, and the vein displays in blue because it's deoxygenated blood. And that's something that you probably have picked up in your language of medicine. So as we continue on with this case, this information will become more and more understandable for you. So here are some important terms. We have CABG, which is an acronym for coronary artery bypass graft, a vessel, which is an artery or a vein, and we just saw an example of that. Graft, which is replacement of one or more vessels. Anastomosis is sewing or suturing of a vessel. Harvesting is taking a vessel from one place to use for another. And then we have occlusion, which once again, this means blockage. We also have the term varicose, which is a weak valve or weak valves. Valves are in the vein that allows the blood to flow backwards or backflow. And I know many of you have heard of the term varicose veins. Well, one of the problems with your arteries and vessels is that if the valves are not opening and shutting properly, then the blood is allowed to backflow and mix with the clean blood. So as we breathe in fresh oxygen and our hearts beat, every heartbeat pumps fresh blood throughout our vessels, beginning with our arteries and then further over into the veins. So when the veins are weak, the deoxygenated or poison or toxic blood backflows, and that creates sometimes what we can see in people's legs as those little blue spidery looking veins, and those are varicose veins. Now we have bypass, and it means to go around or a secondary route. And the reason I'm going over these important terms is because these are things that we are going to see presented in our case and explained in our case as we continue to code. So I want you guys to know what this means. And remember, if you have a copy of this information, you can kind of compare it to your case as you're going through and highlighting. So here's a picture of some arteries of the heart, and these are not all of the arteries, but these are the most common that we see. As we can see here, and I'm not sure if you can see my mouse, this big, huge artery is the aorta. This is where the blood flows or comes back into the body once it pumps from the lungs. So as you know how the heart operates, we have 4 quadrants, and in each quadrant there's a pocket of blood that pushes through, and then eventually the blood travels over to the lungs, ends up down to the arterioles where it picks up oxygen or fresh oxygen as we breathe, and then it travels back to the heart through the aorta, and then the aorta, superior and inferior vena cava, supplies the rest of your major arteries and vessels and arterial branches with fresh oxygen. And from there, the blood continues to pump, and it starts with the arteries and works its way over to the veins. And then as it works its way over to the veins, the blood becomes carbonated or more and more deoxygenated. So that's why you see the veins are always displayed as blue, because there's less oxygen, and the arteries are displayed as red because these are freshly supplied oxygenated vessels. So now that we've covered that, we can see here, this is just showing us the different branches that pulls through the heart from the aorta, having being supplied with fresh oxygen. We're just showing here the right ventricle and left ventricle, but we can see here the right atrium and the left atrium should be displayed over here, but we're looking at kind of a sideways angle. And then we're looking at these different names of these arteries. So as I continue to go through the case, you're going to understand what I mean by certain arteries or different branches. One of the branches that are mentioned in this case, which is not on this picture, is the mammary artery. And we're going to see what that looks like. And let me move over to the next. So we have the subclavian artery, and we have the mammary arteries. There's one on the left and one on the right. And then this is an example of what a blocked coronary artery looks like. And it's just a small blockage, but the picture that we saw earlier shows the actual yellow, milky, greasy looking stuff that clogs the veins. But this is just showing a little small blockage here. And so what we're going to do is we're going to go through the case, and we may have to come back and look at these pictures, give or take, so that we can have a good depiction of what happened. So the first portion of the case that I want to discuss is the postoperative diagnosis. The postoperative is usually the same as the preoperative, but in this case it's actually, it's pretty much the same. So I highlighted in pink the postoperative diagnosis. That is atherosclerotic heart disease. Now, as we go into our diagnosis coding for this case, you're going to see that there is a variety of ways to code this. And so the reason I do have a picture or pictures of the cardiovascular system is because I want you guys to code it accurately, and I want you to do it with great understanding and understand exactly why it has to be coded this way. The good news is that we're only going to have one diagnosis for today. So as usual, I go into the short description of the procedure. This procedure is coronary artery bypass graft 2 times or times 2 of the left mammary artery, to the left anterior descending bypass, and a single saphenous vein bypass from the aorta to the obtuse marginal branch of the left circumflex. Now let's take a look back at the picture and see if this makes a little bit more sense to us. So we have the, on the case, it is mentioned that there is an obtuse marginal branch. As you can see, we have the left marginal artery, and the left side of the heart is where most of the atherosclerosis is in this patient. So that's why I'm going to refer to everything on the left. So here we have right or left marginal artery listed here, and then and the other picture shows the mammary artery. So we start with the main artery, and as we can see, like in this example here, and this is a different artery. This is the marginal. This is the what they call anterior descending, and that's mentioned on here as well, left anterior descending. The main artery is here, but as you can see, as it spreads out, it's considered a branch. It branches out even further. And the further that it branches out, what happens is these smaller arteries connect to veins, and veins continue to further break down into what we consider venules. And venules is what nourishes our body as we breathe or as we eat. So it starts with the bigger vessels, and then the blood and our nutrients continues to fill the smaller vessels. And what we're getting our nutrients from are the smaller vessels, or the little tiny little things called venules. Okay, so once again, we have a picture of the mammary arteries here. And so this case is telling us something about the left mammary artery to the descending bypass. And we see here descending was on the other picture. Let me go back. Descending here. And this is kind of like the middle of where the grafting will take place. So as we continue to go on, you're going to see how all of this comes together. Okay, so they're talking about the indications, and this is generally why the patient received the surgery, but I didn't highlight anything in here because the patient has unstable angina when he had a cardiac catheterization in a previous surgery. And then they noticed that he had coronary artery disease. Coronary artery disease is probably because of the atherosclerosis. So as they continued to operate and dig deeper, they found out that the reason the patient has unstable angina is because of the atherosclerotic heart disease. So this is not a diagnosis that we would code simply because it is a sign and symptom of a more major issue. So this is why I did not highlight anything here. So now we look at the findings at surgery. So we're gonna, and I'm gonna give you a list of information to jot down. We have left anterior descending, and it's gonna be a few slides in, so just worry about it when I get there. We have the left anterior descending artery was diffusely diseased throughout and measured 1.5 millimeter in diameter. Now that may not be important, but let's take a look back. As we can see here, when they give us the size of the millimeters in size, or what it measures, it's basically telling us that there's so much blockage that there's not enough blood flow to get through the vessel so that the patient can breathe properly, and it's a strain on their heart. So that's why it's giving us the measurements. And so it's telling us that this area is where it was grafted, or where the surgery took place to correct that issue. Then we have the internal mammary artery was 2 millimeter vessel of good quality with excellent flow. So here it's basically explaining the state or the condition of the vessels as they went through and found, what was wrong with the patient at surgery. Then it's talking about the vein was a 6 millimeter diameter vessel of poor quality, somewhat varicose, and was used in reverse fashion. So earlier I gave you details about varicose veins, in that the valves are not opening and closing properly to allow backflow, because the blood is only supposed to flow in one direction and one direction only. So when it backflows or regurgitates, patients have that, like I said, those spider veins. So the reason that they're using this vein in reversed fashion is because the blood is already flowing, or the valves are already flowing in the wrong direction. So when they took it out and put it in upside down in the heart area, it allowed for a better flow. And you guys are going to see that shortly. So I just want to kind of give you some more information to make a little bit more sense of the case. So he's saying it was not harvested with this, but however, it was harvested. He's just saying that he didn't use an endoscopic technique. Now they're talking about the obtuse marginal branch was 2 millimeter in diameter and was of good quality. So they're giving you the poor quality vessels and they're giving you the good quality vessels for a reason, because they're going to use the good quality vessels to bypass on the poor quality vessels. So now we're going to get into the procedure, and as you can see, I only highlighted the details that are important to coding. So he's saying that a segment of greater saphenous vein was harvested from the left thigh. So as you can see, he went down in the leg and cut a chunk of the patient's vein from there, and he prepared it for grafting. Grafting is kind of sewing it or replacing it in the coronary arteries. Then they're saying they cut the patient's chest open and the left internal mammary artery was taken down and prepared for grafting. So he used a portion of the mammary artery that's coming from the aorta to replace the blood flow someplace else. Okay, and then here I highlighted the end of the greater saphenous vein was then anastomosed to the proximal portion of the obtuse marginal branch. We're going to see a picture of that. The left internal mammary artery was then brought down to the junction of the middle and distal 1/3 of the left anterior descending and anastomosed there too. So we're going to see a picture of that as well. So now I want you to get a pen and paper out, and we're going to look at the procedure details list so that all of this can make some sense to us. Here are the procedure details list. 1, he harvested or took a portion of the saphenous vein from the leg. 2, he harvested the mammary artery or cut it to reuse it because it's already at the heart, so he didn't have to take it out of the heart. He just took a portion of it and cut it off. The saphenous vein was anastomosed or sewn to the obtuse marginal branch. This is the coronary artery bypass graft venous. The mammary artery was grafted or sewn onto the left anterior descending artery. Coronary artery bypass graft arterial. Okay, so before we get into the coding portion, I want you to see the end result of what happened. So this is where, and this is probably not exactly what this case looks like, but this is the closest that I can get to an example. So we see here the mammary artery, and it's showing on the left. You see bypass using internal mammary artery. Mammary artery was cut from where it usually lives or resides in the heart and brought further down to connect to this little branch, the medial distal 1/3 of the descending. So this is where they corrected the blockage and bypass blood flow from here to go from here and feed these smaller vessels. And then what they're saying is bypass using a harvested vein to another coronary artery. So this right here would be considered a saphenous vein. They took a portion of the saphenous vein, anastomose, which is sewn it onto a poor vessel, and it was actually sewn onto the obtuse marginal branch, which is where this should be in the case, and took into the aorta. So basically what they're saying is the aorta, which has the richest supply of blood, was connected to another area to bypass the flow to create an even flow. Now this right here just shows us, and this is not in our case, but it shows us a third harvested vein. So one of the rules about coding for coronary artery bypass is that you code for each bypass graft that was placed in the surgery. In our case, I could put an X right here because he only did 1 and 2. So our case says ×2. So now that you've written that down and basically have a picture, in front of you, if you've downloaded this presentation, we can do our coding. Okay, so you want to ask yourself, what is our main term? Our main term is arterial or atherosclerosis. The reason it's saying atherosclerosis in the case, and I'm looking up arteriosclerosis because it really doesn't matter, but athero is another term for artery or vessel. Arterial is another term for artery or vessel. So as you can see here, I have arteriosclerosis, arteriosclerotic. As I move here, we see that it is of the coronary artery because that's the artery that needed to be bypassed. Okay, so this is our initial place of where we began. Now we can look a little bit further down to determine if any of these other diagnoses make sense. Well, we see here that the patient has, from their indications, they had angina pectoris. We don't code angina pectoris separately because it's included in the code for the coronary artery. The only issue is that we see native vessel indented under coronary artery. The reason we're seeing that is because the coronary artery itself was not completely calcified, but a vessel or a native vessel, and let me pull this over here. Hopefully I can show you how this looks. Okay. So one of these other vessels that's connected to the coronary artery is atherosclerotic. So it's not just the coronary artery itself, it's the circumflex or the mammary artery or the obtuse marginal branch. So that's what that means by native artery. Okay? Okay, so moving on to coding for the procedures. We have a few different ways to research or look for our terminology in our index. What we want to do is start with the simplest method first, or the simplest method, period. I will say that you can look up CABG, coronary artery bypass graft, or just the acronym CABG, and you will be taken to a full range or several ranges of codes. Or, excuse me, you can go to the word coronary, which is what I did. And then from coronary, I looked down to coronary artery. In this example that I have here in front of me in my index, I see coronary artery, and I see a lot of different things like angiography, angioplasty, atherectomy. None of these happen, but here's the word or words, bypass graft. It's giving us the code range, the same code range that we would run into if we go to the word CABG, but we have two separate indentions underneath. We have an indention for arterial, which is what happened today. And we also have an indention, if we go a little bit further down, we should see a indention for venous, which is also what happened today. So let's look at arterial first. So we have arterial grafting for coronary artery bypass graft, and it's just giving us a code range for using arterial grafts, single arterial graft. Did this happen today? So we kind of want to look at the case, and like I said, what did he do? He pretty much did, and let me get my screens together, and I'm going to look at the case while I have this open. I want you guys to stay in your code manual right there. So he did a coronary artery bypass graft using arterial grafts. Did he use arterial grafts? We can say the mammary artery was connected or anastomosed to, and where is that? Was anastomosed to the proximal portion of the obtuse marginal branch. Let me go back. Mammary artery was brought down to the junction of the middle and distal 1/3 of the left anterior descending and anastomosed thereto. Mammary artery, one artery, brought down to the 1/3 of the left arterial descending and so on there. So did that happen? Yes or no? So you can ask yourself those questions. Was it one artery, two arteries, three or four or more? So as we looked at the case and we looked at pictures and examples of what happened, you can kind of determine if that is appropriate for your coding. Okay, so let's look back at venous. Where is it? Right here. So we have venous grafting only for coronary artery bypass graft. So let's look at what it's saying here. Single coronary venous graft. Did he do a coronary? Vein graft was anastomosed, completed the end of the greatest saphenous vein, was then anastomosed to the proximal portion of the obtuse marginal branch. Okay, so did this happen? And what I'm thinking is that we're missing some details because, let me go back. It's kind of ending right here. Because this is if we did venous graft only, and we did not do just venous graft only, we did venous and arterial. So let me go back up to CABG and go here and pull the full thing up. I can't see it on my page, but I know you guys can see it. For some reason, I'm not getting, arterial venous. That's what I'm looking for. So on the index, I should have pulled arterial venous. We already have the code. We should have two codes. We already have the code for the arterial bypass graft only, but now we want to pay attention to the coronary artery bypass using a venous graft and arterial graft. So we have a single vein graft listed separately in addition to the code for the primary procedure. So this is an add-on code. This code should be used in addition to the code for the coronary artery bypass, which is the very first code that we saw first. And in parentheses, it's telling us use this code in conjunction with this code. So we had the provider do a mammary bypass or a bypass of the mammary artery to 1/3, the distal 1/3. So that's the arterial portion. And then he took the saphenous vein and he bypassed it to the other artery, which is the proximal junction. The vein graft completed at the end. Proximal portion of the obtuse marginal branch. So this, we only have one venous graft and we only have one arterial graft. But as you can see, we have to code for the arterial venous. The other code would be appropriate if we only had the saphenous vein bypassed in the heart only. But since we had both, then it's important to use both. And as you can see, my book is a little limited. That's why I kind of like coding out of the CPT, because I would have been able to see all of this on one page. And what I had to do was kind of go back and forth. But as you can see, we have this code here is an add-on, but this code 33533 is listed underneath. And this is exactly how it should look in your CPT. So let's go back and look at the actual pictures and see if everything makes more sense to us. Okay, so we're right back at the end result. We have the saphenous vein here, which is our vein graft, and what he did was he took the saphenous vein to the proximal portion of the obtuse marginal branch, which we can kind of say this is the proximal portion of the obtuse marginal branch. This is just showing the right side of the heart. We should actually be doing all of this over here because everything was on the left side. Okay, right here. Then we're going to look at the mammary artery. The mammary artery was brought down to the junction. This is a junction. A junction is where two of them connect, like a neighborhood street. Of the middle and distal 1/3 of the left anterior descending. This is technically the left anterior descending. This is what I want it to look like on my picture. Let me go back a little bit. Mammary arteries. Okay, so this is the left anterior descending. So we don't see the mammary artery, but basically we would see it come down here and connect here. And then what he did was he took the saphenous vein and he did the marginal branch here. He put that vein here and kind of connected to the aorta. So we have one venous, one arterial, and one diagnosis. And as you can see, it's a little bit more detailed than what it usually is every week, but this is actually a really good case to learn about coronary artery bypass grafting. I know that you're going to run into some scenarios that says harvesting of the vessel and code separately, but one of the rules with coding or harvesting of the saphenous vein is that it is included in the procedure. So that's why we didn't code any harvesting for today. So hopefully this makes perfect sense to you guys. If you have any questions, feel free to text, email, or give me a call. Thank you. Have a great day. Bye-bye.